right. So, good morning. Um, and we are here for our weekly press conference and update to the public with respect to all things Corona. And we're going to begin with a couple of things. First off, we wanted to hear from APS, so we're starting a little bit late today, and we'll give an update about what our public school system announced today, and then follow our usual format. And let me begin with, I think, by saying that these next 2 weeks, all indications show, are going to be very difficult for our country. It seems to be, again, there's lots of models out there and no one knows for sure, but it does look like the next 2 weeks are going to be sort of peak surges all across the country. Here in New Mexico, of course, we're a little bit behind the rest of the country, but we're on a similar timeline in that we do expect things to get very tough for us this weekend and next week. Is where we're really concerned, but also working hard on dealing with capacity constraints in our healthcare system and for other public safety and public service safety nets. So I just want to give everyone a heads up that I think it's going to be a rough week next week and going into the weekend. But we are doing a lot to be prepared for that. And so the good news is a lot of the measures that, of course, the state, county, city, everyone has taken up until this point, hopefully will go a long way to helping us get through the next few weeks. So some updates from our Joint Information Center. Want to mention that our planning, logistics, and operations sections of the EOC, we are working on how we're going to deal with the next few weeks, whether it's with respect to supplies, shelter, beds, different options for people who might get sick and don't want to go home, can't go home, and also can't go to work. So this sort of third space, this respite concept, again, something we're working on, and we will be ready in the next few days. So stay tuned for more on that. Now, state police have put out further guidance on violating the public health order. I would really check out, they have a nice 2-page FAQ on their website that you can check out. A couple of highlights is basically they're doing a first report, warning, a second warning, and then third or subsequent offenses, they may take enforcement action. That can be a $100 fine or up to 6 months in imprisonment or both. And that's the criminal penalty. There's also civilian penalties that folks may face, including a $5,000 fine for each violation. So check out their public health frequently asked questions update, and we'll have links to that as well. For details, if you want to report violators of the closure ordinance, you can email nmsp.covid19@state.nm.us. You can also call, I think it's 1-833-551-0518. And so again, APD is playing a more specific role. That's just an update from the state police from their public material. Okay. APS today announced that they're going to distribute Chromebooks to families of high school students who don't have access to a computer at home. Students must bring their student ID to check out a Chromebook for the rest of the school year. If you've lost your ID, make sure you at least know your ID number, and a parent or guardian should accompany a student if possible. There are some limitations, 1 Chromebook per family, and these are going to be distributed by grade level, and they can only be used with an APS login, which is going to be provided. So more information on that, of course, at the APS websites. And also want to mention that there are 3 school-based health clinics that do remain open. That's Emerson Elementary School, Grant Middle School, and Atrisco Heritage High School, APS public health centers that are still open. Now, with respect to enforcement here in Albuquerque, we are continuing to see challenges at our big box stores. Not all of them, but some of them. And I believe there's going to be further information coming out from the state on this, so stay tuned for some details. But we do know, for example, one big box store had a sale this weekend. Lowe's, I mean, it's not like a secret. Lowe's was packed, and we had some calls into law enforcement because of that. We'll see what the state does, and hopefully that'll take care of it. If not, we'll be looking at unilateral action in the city of Albuquerque to deal with folks. There's all sorts of ways to do this better, and other big box stores are doing that, whether it's metering, it's making sure there's appropriate staff protections, but also staffing levels. All of those are good ideas. I want to mention there are a lot of stores that are doing this. Thank you. You're doing a great job. We just need everyone to do it. So for the stores that are not doing this, please look basically to your competitors in terms of how to do this right, and stay tuned to see if there's more information to come in the next few days on that. Okay, with respect to city services, we're going to phase in our screening procedures at all city facilities. So that is dependent on things like equipment and so forth as well. But again, we're going to follow the CDC standards for screening employees, and we hope private businesses that are essential also continue to do the same. Now, we want to have really two deep dive focuses today. We're joined by some regulars from our environmental health department, Dr. Mark DeMena and Director Ryan Mast. They're going to touch on some challenges we continue to have at our nursing facilities. I think we've all seen what's been happening, of course, at one of them. And also we're going to talk about some of the work that the EOC has been up to. First and foremost, though, let's talk about nursing homes. Our nursing home facilities, which include skilled nursing homes, assisted living facilities, adult daycare facilities, hospice facilities, rehab facilities, and older adult population facilities with older adult populations. All of these are at extremely high risk, and we have been reaching out, as I mentioned, all last week to try and institute some best practices in these facilities. We've reached out to 150 plus in the Albuquerque area. We have 10 plus that have not gotten back to us. We are going to talk about this in a little bit, but this is extremely important that these facilities connect with our environmental health department or with the State Department of Health immediately. We'll talk about that in a little bit. But here's what we're telling them to do in conjunction with our Department of Health. We want to make sure that they're following strict infection control guidance with respect to healthcare workers that are visiting the facility. We also want to make sure that they're screening everyone on the way in, again, with the standard screening for fever, cough, shortness of breath, or sore throat. We also are trying to make sure that all residents are being screened for this as well, residents and staff, and if anyone's positive, that they're then isolated. I think the biggest thing that seems to have been occurring in a couple of places last week was activities still being conducted in group rooms, though that should not be the case at any facility. And also communal dining should have stopped long ago, so should not be occurring at any facility. So these are the kinds of things our department is checking on, and we're working with our partners also at Senior Long-Term and Aging on this. But we want to make sure that dining should occur in residence with single service items, and also that in general, all the social distancing rules are followed with respect to inside the facility. So if you have questions about this or need guidance, please call 855-600-3453. That is NMDOH. You can also visit, of course, their website. You can also call the state's long-term care ombudsman at 166-451-2901. And with a little bit more on this, I think Dr. Mark DeMena is going to go into this. Mark?
Thank you, Mayor. Clearly, the nursing homes, the types of facilities that Mayor was just describing, are the folks that are the most vulnerable. We see what's happening right now with La Vidiana, the difficulties that they're facing. One case can turn into many very quickly in such a vulnerable population. We are sensitive to the fact that these facilities have a lot of residents and a lot of staff that they have to deal with, and they have some logistical concerns with making sure that people continue to be fed and continue to receive the care that they need. We just want to make sure that everything that they're doing is as protective as possible. So in taking the guidance that's come down from the governor's office already, and in what we know are best practices, we've been reaching out to facilities last week. We talked to 155 facilities throughout the area. That's based on the permits that we have for folks. Those are all the calls that we placed so far. We've talked to most of those facilities, made sure that they understand what we're asking for, make sure that they understand the specifics, what it means for them. As Mayor just mentioned, we found some places still had communal dining going on. While they were spacing out 6 feet apart and keeping the tables fairly thin, the room itself has far more than the 5 allowable people. That's very dangerous. We understand that it's difficult to make that transition, But again, these are very vulnerable populations, and the highest, most protective level of care has to be thought about. So we're telling them no communal dining. They can't be in the dining room. There can't be these activities or social gatherings going on. There should be no outside visitors. So those are some of the critical things that we're talking about. We're also walking them through the screening guidelines for staff that are coming in and what they can look for in their patients in terms of symptoms and how they can arrange for testing as soon as they think something's going on. And again, emphasizing that patients should be isolated to their room if they think that they're positive, they're awaiting test results, or if they're symptomatic. So we did have a few facilities we haven't been able to reach out to so far. We haven't been able to make contact to. I'm going to read them out because we really want to hear from these facilities. So if this list includes a facility that you're working at, please call us at 311. Ask to talk to environmental health right away. We want to make sure that the guidance is really clear. We want to make sure that we don't have any other facilities that have rapid spread. So that's going to include Dearson Charities, Inc., Uptown Rehabilitation Center, Marlar Manor, Namaste Living, Princeton Place, Robin House, Sandia Senior Suites, Sandia View Spain, Silver Wings Assisted Living, Tender Heart, Tercer Cielo, the New Beginning Senior Living, the Village at Alameda, Total Community Care, Turning Point Detox, Wellesley Care Home, West Ridge Village Assisted Living, and Wilson Family Care number 3. So again, if I just listed your facility, please reach out to us at 311, ask to talk to environmental health about what you heard in this, and we want to talk to you right away and just make sure that the guidance is being followed. We will be checking regularly with all of these facilities to make sure that that guidance continues to be followed, to make sure there aren't additional questions or concerns, or to make sure there's not information that concerns us in terms of potential cases appearing, and we would relay that to Department of Health. Thanks.
Okay, and relatedly, demoing new face mask. I got one for my 5th grade teacher. So Christine Luke, better known as Miss Jones, thank you so much. And wanted to also mention it's Face Mask Monday. So everyone can rock your face mask, and we can all stay a little bit safer. So with more from our Emergency Operations Center, Director Ryan Mast.
Thank you, Mayor. So my name is Ryan Mast. I'm the Director of the Environmental Health Department for the City of Albuquerque. As the Mayor mentioned before, the next couple of weeks we do anticipate being a really important time for this current emergency, and we've been working very closely with our partners both at the state and county level to make sure that we're prepared for that. At the Emergency Operations Center, that means that our activities are greatly increasing this week. A couple things that we're really kind of focusing on is, one, to make sure that our first responders are able to work very closely with the needs of the hospitals as well as the other healthcare providers to address any potential needs that they have on not only regard to transportation but also sheltering needs. We also want to make sure that we're looking out for our first responders, so we're planning for alternate plans for them so that we can make sure that we are providing them a safe environment so that they're not continuing to be unsupported in their activities out there. So we're working very closely to sort of just not only just polish those plans, but also to make sure that we're working very in coordination with our partners at the state as well as with the hospitals. This is the time where all of our resources can start to begin to be stressed, and so we're definitely making sure that we're providing that appropriate protective equipment as well as the messaging to everyone so that we are keeping ourselves safe just as we are asking all the public to help us out with that. Because we have seen some of the positive benefits of some of the risk reduction measures or the mitigation measures over the last couple of weeks, we are encouraged by those signs, but now is the time to really dig in on that and to really make sure that we are all practicing those best practices that we know. That includes the physical distancing, that includes staying home if you're sick, it includes limiting the number of people that need to go out if you do need essential supplies. It's all of our responsibility right now, especially more than ever, to try to keep everyone in the community safe, just as we are having our first responders prepared to keep you safe. So thank you. That's an update for right now. Thanks.
Okay, thank you so much for that. A couple of other items. Ways to help. We do want surgical mask donations. I want to be clear, surgical masks. So we are taking those right now. and you can drop them off at our emergency operations centers. Those are going to be distributed to frontline workers. Again, that's different than the N95. I mean, we'll take those too, but the surgical masks are very helpful for a lot of our city workers, and we have a shortage of those as well. I want to thank the anonymous donations of PPE to AFR over the weekend. That was also extremely helpful. And Loveless is also accepting donations of surgical masks. Now, our kind of myth today that we want to debunk is just really about if you don't have symptoms of the coronavirus, you can still be contagious either way. That's why community spread is an issue, and that's what's known as asymptomatic. And so that's why first and foremost, we want folks to stay at home. And that's why, especially like when you're out in grocery stores and things like that, that's why it's really good to use the face mask. Okay, takeout in the office today was Garcia's Kitchen. And so with that, let's take your questions.
We don't have any helpers in, so.
Can I just get your last name, your title again?
Sure.
Yeah.
Dr. Mark DeMena, and he's the Deputy Director of Environmental Health.
Okay, cool. Thank you.
Great question. All right. Any others? Okay, well, with that, we're going to see you tomorrow, and we're going to focus on our cultural services team has put together an outstanding way in which we're going to be able to help our creative economy and our creative entrepreneurs. So this is a very substantial program, and it'll be up and running and online and everything tomorrow, and we'll tell you all about it at 11:30. Thank you very much.